Welcome to your EMS Safety Services First Aid Training course. There are nearly 50 million injuries each year in the US. In fact, injury is a leading cause of death in children and adolescents. Many of these injuries are preventable. By learning how to prevent and quickly respond to injuries and illness, you can make your home and work environment safer. In this course, you will learn the most important actions to take to save a life. So let's get started with a few basic things we should all know.
Even though there's already enough to worry about during CPR, I know many of you are concerned about the legal issues that may arise when attempting to save someone. There are 3 areas to discuss here. The Good Samaritan Law protects you, the citizen rescuer, from the fear of being sued when responding to an emergency. Rescuers who respond voluntarily without compensation and stay within the scope of their training are protected under this law. Next is gaining consent. Everyone has the right to refuse care, but when the victim is unresponsive, as in when you're performing CPR, consent is implied under the law. The last thing we want to mention is the victim's right to privacy. Just as doctor-patient confidentiality operates, any information you obtain about the victim's medical condition is strictly private and not to be shared with anyone, such as coworkers or bystanders. Our next short topic is bloodborne pathogens. What are bloodborne pathogens? We've all heard of HIV and hepatitis B and C. These are the most notorious examples of bloodborne pathogens, diseases which are transmitted when the blood or body fluid from an infected person enters a rescuer's body. During CPR and first aid, rescuers can be exposed to bloodborne pathogens. Fortunately, with the use of a little common sense and personal protective equipment, exposure can be greatly reduced. How do we prevent exposure? To know how to prevent it, we first need to know how it occurs. There are 2 methods of exposure: through a direct splash on a rescuer's eyes, mouth, or nose, or through a break in the rescuer's skin, such as a scab, a fresh cut, a puncture, or a rash. There are simple steps to prevent an exposure. First, assume that all body fluids are infectious. Second, use personal protective equipment whenever you think there is a risk of exposure. Personal protective equipment, or PPE, includes the use of moisture-proof gloves, protective goggles, and a CPR barrier device for rescue breathing. Unfortunately, even with proper protection, exposure can sometimes occur. If you are exposed to blood or body fluids, take the following steps. Wash any exposed area immediately with soap and water. If splashes to the nose, mouth, or eyes have occurred, flush the affected area thoroughly with water. Dispose of any contaminated clothing or objects in a leak-proof container. Report the exposure to your supervisor if you're at work, and follow up with your physician.
I'll call maintenance, Jimmy. Just leave it alone.
I've got it.
John, is it too late to get this out?
Nope. You just made it.
Thank you. Jimmy.
Oh my God.
Each year, too many Good Samaritans needlessly die or are injured because they fail to stop and take a breath before they respond.
Now, let's all take a deep breath. Breath is an acronym to help you identify scene safety and treatment priorities. B, you want to be prepared. This means getting trained in CPR and first aid and getting equipped with PPE, getting barrier devices and first aid kits for your home, work, and vehicle. And of course, carrying a cell phone. R, relax. It's easy to get excited or overwhelmed in an emergency situation. So relax, take a breath, and think about your priorities. What is priority 1? Environment. Assess the situation. Is the environment hazardous, Is there traffic or fire? Are there loose electrical wires or chemicals? Remember, your own safety comes first. Once you've established that it's safe and you're at the victim's side, begin with the ABCDs. The ABCDs guide a rescuer through the top treatment priorities in any emergency. We'll learn more about the ABCDs in a moment. T, treatment or triage. Estimate the number of victims and treat those who have the best chance of being saved. And finally, H, help. Call 911 or send a bystander if possible.
Joan, is it too late to get this out?
Nope, you just made it.
Thank you. Jimmy.
Oh my god.
Oh, don't touch it! Turn the power off.
Power's off.
Okay. Jimmy. Joan, call 911, get the AED and the first aid kit, and come right back.
Okay.
Projection system's almost completed, and they should be done with the installation by this afternoon.
Good to hear. I'm glad to see you're finally getting your act together.
Are you okay?
I don't think so.
Severe uncontrolled bleeding in a victim can quickly lead to death. By controlling bleeding, a rescuer can save a person's life. The best method to control bleeding is through direct pressure, which results in blood clotting.
So, we've established that the scene is safe, called 911, checked the airway, and the victim is breathing normally. Rescue breathing, chest compressions, and defibrillation are not needed. Now we can look for and address severe bleeding and shock. The best way to stop severe bleeding is with direct pressure. If the victim is responsive, we ask them to apply direct pressure while we put on our gloves. Take a dressing, shirt, or any available material and place it over the wound with the heel of your hand and apply firm, direct pressure. It may take 15 to 20 minutes of direct pressure to stop severe bleeding. If the original bandage becomes soaked with blood, don't remove it, but rather apply additional bandages and continue direct pressure. Severe bleeding can lead to shock, which occurs when there is inadequate blood flow to the vital organs. Shock is a life-threatening emergency. If the victim feels dizzy, faint, nauseated, or appears sweaty or clammy, lay them down and elevate the feet about 12 inches above the ground. Maintain body temperature. Call 911 because a patient in shock can deteriorate rapidly.
Are you okay?
I don't think so.
That doesn't look good.
Call 911 and get the first aid kit. Okay, now take your other arm, put it on the wound and apply pressure. Right.
The ambulance is on the way.
Okay. Hand me the gloves and open a gauze for me.
There.
Got it ready?
Right here.
Okay. You're gonna remove your other hand, and I'm gonna take over the pressure, all right? Okay? Right. Okay. Good job. There's that box out there, right?
Right.
Let's put it under his feet.
Okay. Thank you. Okay, here we go.
Okay. Let's keep him warm. Can we use your jacket, Barry?
Sure.
All right.
There are more than 1.1 million burn injuries requiring medical attention each year in the US. Burns are currently the third leading cause of accidental death. 4 out of 5 deaths occur in homes, half of which don't have smoke detectors. Fast, effective burn treatment can reduce the degree of injury and even save a life. There are 3 levels of burn severity. A first-degree burn may have redness, pain, and sometimes swelling. A second-degree burn is often illustrated by blisters, pain, and swelling with a red and splotchy appearance. The most severe are third-degree burns that involve all layers of the skin and could also involve fat, muscle, and even bone. These appear charred black or dry and white. There is no pain with third-degree burns because the nerve endings have been damaged. However, the patient may have painful second-degree burns around the site. Whenever burns involve the face, hands, feet, or genitals, they are always considered severe due to the potential for complications.
When caring for burns, make sure the scene is safe so that you don't become a victim. We'll talk about 3 types of burns: thermal, chemical, and electrical. Thermal burns are caused by extreme heat. Naturally, if there are flames, we want to extinguish them. We've all heard the phrase stop, drop, and roll. In cases of excessive heat or smoke, remove the victim from the scene, but watch out for your own safety. Activate the EMS for moderate or severe burns. Perform the ABCDs, looking in particular for evidence of respiratory tract burns, such as singed hairs or soot around the mouth or nose. This is important because respiratory tract burns can cause swelling that may close the airway. Generally, the best way to stop burns is by cooling with water. Because burns can swell quickly, remove any clothing or jewelry that's not sticking to the skin. And if there are any blisters, do not break them because they're protecting the burn area from infection.
What happened? It burned my head.
Ensure scene
Okay,
safety.
it's okay.
Cool burns with water. Cover with dry, sterile dressing. In addition to these more common thermal or high-temperature burns, there are 2 other types you should know about: chemical and electrical. Powdered chemicals should be brushed off the skin, but not with bare hands. All chemical burns, particularly to the eyes, should be flushed with large amounts of water for at least 20 minutes. Ensure that runoff water does not flow over unaffected skin, into the unaffected eye, or onto the rescuer. Immediately follow the directions on the safety label of the chemical and activate EMS. In the case of electrical burns, the most important consideration is to make sure the power supply has been shut off before approaching the victim. Electrical burns can cause deep tissue injury and are often more severe than the external signs indicate. Even ordinary household current is strong enough to cause severe burns or even cardiac arrest. All electrical burn victims need to be evaluated by a physician.